please fill up the seats in the front. We have plenty of seats. Welcome everybody. It's nice to see that we have such a nice crowd out here tonight. Even if we did nothing here but just hang out and have drinks, at least your kids think you're doing something for them. So, but the fact that you came out here tonight is half the battle. We want to thank our hosts for this evening, Mr. and Mrs. Jack and Lottie Terzi, for so graciously opening up their beautiful home to us. Thank you guys. So it's always nice to have a beautiful place to have such wonderful programs. We also want to thank our PTA presidents, Eileen Nasser and Alana Cohen, for their tireless efforts in bringing us many valuable programs into the lives of our children as well as our parents. Thank you. Of course, we would like to thank Lauren Hakim and all of Hashem's messengers from SBH for all of their avodat hakodesh that they do on behalf of our community, bringing programs such as this to our families. Finally, we also want to thank Nina Safdie, who probably fits into all these categories, which is why we did not categorize her. She's SBH, she's PTA, she's everything. You have an organization, she's part of it. If you're doing a chesed, she's right there. And she did not include her name on the list of thank you, so I think we have to put her list on ourselves. Thank you very much, Nina. I started your presentation for you. Okay. All right. I'm going to say. Anybody here anxious children? No anxious children in our school. We're anxious. In Parshat Pekudei, we're told how the Mishkan was built. The Pasuk tells us, "V'tzalel ben Uri ben Hur l'matei Yehuda asat kol asher tziva Hashem et Moshe." And then it goes on to say, "V'ito Eliyav ben Achisamach l'matei Dan," and then he had a whole contingency of people. So it was really Betzalel and his helpers that built the Mishkan. Interestingly enough, at the end of the whole thing, it says, "Vatechel kol avodat Mishkan ohel moed." It was over. The work was over, and the Mepharshim tell us that not that they didn't want to work more, but the instructions were done. The work was over. Vayasu bnei Yisrael kechol asher tziva Hashem et Moshe kenasu. The bnei Yisrael did what Moshe asked. Interesting, because we learn in the beginning that Betzalel did everything. And his crew, they built everything. So why does it end by telling us that the Bnei Yisrael did everything? It's a very interesting fact. And the rabbis tell us that this is because the Torah is teaching us a very important lesson. Someone who does something on behalf of Bnei Yisrael, because Bnei Yisrael delegated them to do so, then they chose the right person, then they did it. Everyone's success is everyone's success. If someone was chosen as a messenger to do something for Am Yisrael, then Am Yisrael has accomplished that when it's done. But it's also teaching us a very valuable lesson. It appears that the Torah is telling us a general rule, that the way the Torah can be observed successfully is by showing that the Bnei Yisrael give merits to one another. In other words, I understand that I have things that I need to do for Am Yisrael, and you have things that you need to do for Am Yisrael. And we complement each other when we do all these things. Gidul Banim, raising children, is something that every parent sometimes feels is on them, is their own responsibility. And when something's not going right, I got to know all the answers. I have to know all the answers. But no, knowing where to send your children to learn certain things, knowing which schools to send them to, which people to ask for when you're going through something, anything that's going on. If your child needs, anything in their life, knowing the right people to ask is half the battle. And I think that that's what's so important about something that's going on tonight, that to know that in your journey of raising your children, when we raise our children, you're never alone. We all complement each other,
And yes, it's our job to do, but it's also important to know that when you ask for help and you get help, and then you work together and your child succeeds, you did it. It doesn't mean that just because someone else was appointed to do it and they did it, that it's only them. It's you who decided that we have to complement each other. I did everything I can, but this is beyond my reach, and I'm asking for help. And that's why it's so important that we have wonderful organizations like SBH to bring these wonderful programs. Our special guest tonight, who I'm not going to introduce because that is going to be someone else's very chashuv job. So at this point, I'd like to call on Lauren Hakim from SBH to introduce tonight's speaker. And thank you all for coming out tonight.
Thank you, Rabbi B. And thank you, everyone, for coming. I echo the Rabbi's thank yous, really, to the most gracious hosts, Lottie and Jack Jersey, for really opening up their home to everyone tonight. And also to the Hillel PTA, to Aline and to Ilana and to Nina. Thank you so much, really, for handling all the details and all the beautiful setup. And we hope that you all enjoy the refreshments that we have inside. So really doing a wonderful job. I also want to thank our partner organizations, Hillel Yeshiva and LCSC, Lakewood Community Service Corporation. They have a wonderful team, Sarah Gelbach as their executive director, and Shmuel Milworm is here with us tonight, who's the director of operations. Both organizations collaborated and co-sponsored this event with SBH, enabling our community the opportunity to be educated on this very important topic. SBH Jersey branch has been servicing the New Jersey community for over 30 years. We provide a multitude of services, including a kosher food pantry, assistance with securing government entitlements, employment opportunities, educational lectures, senior services, case management, and more. For the last year and a half, we have been very fortunate to partner with LCSC to offer a satellite mental health counseling center at our location on Norwood. We have seen much success with the counseling center and are continuously growing, adding more therapists, and expanding our services. Currently, we are open from Sunday to Friday and provide counseling for children, adolescents, and adults. This year, we have also expanded and brought our search division to New Jersey. Gloria Izan has joined our staff as an educational advocate, and under her trained eye, we are able to help parents better understand their children's learning differences and access the necessary resources to ensure their student success. We are very enthusiastic about tonight's lecture and look forward to offering more educational programs throughout the year, highlighting a variety of mental health topics and learning differences that affect children. If you would like more information or to volunteer to help with any of these events, please feel free to reach out to us. Our contact information is in the folder on your chairs. Tonight, we are very pleased to have our featured speaker, Montes Miller, the founder, director, and supervisor of the Center for Cognitive and Behavioral Therapy of New Jersey, and author of the groundbreaking book, Uncontrollable Child. Mr. Miller is a licensed clinical social worker, certified cognitive behavioral therapist with 18 years of experience. His impressive educational and training background includes certification in CBT from the Academy of Cognitive Therapy and the Beck Institute for Cognitive Behavioral Therapy, and certification from the DBT Linhen Board Certification in Dialectical Behavioral Therapy. His expertise in CBT, DBT, and schema therapy compelled him to found the center and select the finest therapist to complete his team. Montes specializes in severe emotional and personality disorders, anxiety in teens and adults, and parent training. He's a seasoned lecturer on CBT and DBT related topics, addressing parents, clients, and professionals. And he's presently focused primarily on supervision, education, and consultations. Please join me in welcoming Montes.
Thank you so much. It's a pleasure really to be here this evening. And I echo all those thank yous that were mentioned already, and certainly to LCSC and SBH for inviting me here tonight, and for the hosts, Lottie and Jackie Tarzi, for opening up their home. I can feel the warmth from their home, and it's wonderful to be here. Tonight's topic is my anxious child. And each of you are taking the time this evening to come here to learn, to help your children. And that already, as was mentioned, says a lot about who you are as parents and your caring. Or perhaps you just want to leave your anxious children at home and get a break. Could be one of the two. But it does say something about your openness to grow and learn. And my hope is that this evening you will be able to learn and have practical tools and information that you can take with you today. So the topic today is about anxiety. And anxiety is often under-recognized in children for a variety of reasons, because children don't present with anxiety the same way as an adult would present with anxiety. We might see certain behaviors such as school refusal or avoiding places, sadness, irritability, physical symptoms, but the children aren't able to necessarily express or verbalize their emotions and what they're feeling, and therefore it might be hard to identify that. So the majority of the information that I will present to you tonight is information to understand what anxiety is, what's normal, what's abnormal, when is it a time that it needs more clinical intervention, and what are some tools that we can actually use ourselves. Firstly, the awareness and understanding what anxiety is and having the language and the ability to communicate with our child about anxiety, that in itself can do worlds, as we're going to see, but also having some technique. And even if your child is currently getting some treatment, or perhaps even yourselves are getting some treatment for anxiety, having a better understanding and a clear understanding and some tools can be extremely helpful. So as we go through this evening, I would love some discussion and questions, and at certain points we'll stop and take some questions so we can make this more stimulating and engaging. And I'm also would love the opportunity if someone has a certain situation and perhaps you even want to come up and role play. And if you want to notice your anxiety as you come up here, and we can actually address your anxiety on stage, if that's something you might be experiencing. So today's agenda, so we're going to first understand anxiety. I'm going to give you some overview of cognitive behavioral therapy and some evidence-based interventions to address anxiety. And I'm also going to teach you about the do's and don'ts with your child, because we might not have the skills to know what to do to address their anxiety, but what we might not realize is there are many things we're doing that's actually impairing our children even further and causing even more problems. And I hope to teach you that, and we'll bring this all together. So let's start with Jack's story. Jack's in the 6th grade and always been a bit clingy, shy, nervous. This year, during a school trip, he got sick and vomited on the bus. Ever since, he has refused to go on the school bus. He will often not go out to play with friends, complaining that running around makes him feel dizzy and sick. And he refuses to go to school many mornings and spends a lot of time in the nurse's office, saying he thinks he's going to be sick and there's going to be some problem and he needs to go home. So I don't know how many of you have a Jack, or maybe someone like a Jack in your family, but just think for a second, if you had a child who was struggling with anxiety to this degree, what would you do? How would you respond? Maybe even if you want to jot down some notes and just see the difference before and after if you're curious. But really to think about your child right now, a child struggling with this, what would you say? What would you do? How would you respond when the child is refusing to go to school? When the child is at the nurse's office every day? How would you respond to that child? And we see anxiety in children in many areas. And you're here tonight perhaps because your child is displaying or exhibiting some of these symptoms. Fear of dark, fear of separation from parents. There's fear of sinning, fear of not doing things perfectly, fear of not being normal. That might be more of an adolescent thing, like I'm not normal or I'm socially off. Fear of doctors, shots, dentists, heights, fear of needles. Sometimes you see children who have a fear of individuals who have special needs. So we're going to hopefully touch on some of these topics, but these are really common fears that we see in children on a regular basis. So what is anxiety? So God has created an internal alarm system that actually is there to protect us from harm. And it's like what we refer to sometimes, it's like a fire alarm that goes off in our system. And that internal alarm system is there to detect threat, danger. When there's a concern, it activates. And when that activated threat system happens, many things go on in our body. We have fatty acids, chemicals, hormones, as some of you maybe know, adrenaline, rushing through our body. So our heart starts pumping faster, rushing blood, and our lungs actually dilate. Our eyes dilate. It's fascinating. So we can take in more. So we can take in more air. So we can have more energy in order to fight or address the anxiety. And we need that for survival. You know, if you're sitting on the beach not far away from here and something huge wave comes, you don't want to sit there thinking, maybe I should move away, right? Because it might be too late. It's your body alarm system activates physiologically and you move automatically. and it's necessary for survival. That means anxiety is necessary for our children to grow up in the world and to be successful. People come into my office and they say, I want to get rid of my anxiety. It's killing me, it's horrible, it's so uncomfortable. And what I say is, let's see if we can help you learn to regulate your anxiety, to decrease your anxiety. Anxiety is something that's necessary because it enables us to be able to deal with the dangers that we have in our lives. Anxiety also, if you noticed, if you're ever really anxious, you're not hungry, right? Your digestive tract actually slows down in order that it could focus all your energy on the situation at hand. So there are many things that are going on in our bodies that are necessary. So with that, here is what the best name they came up with this was the upside down U. But perhaps someone in the crowd could come up with a better name for that. So this is the stress anxiety performance curve. So really when we have anxiety, it helps us with performance. Whatever we're doing, and as the anxiety, we can see as it's going up, our performance is going up. It helps, and it helps, and it helps, until it hits a peak. And at that point, it starts to go down, where the anxiety gets so intense and starts to impair you. So where is anxiety helpful, where is it harmful? Well, let's think about it. Your child is taking a test. They have test anxiety. You want your child to have test anxiety, because if not, it's that child who says, yeah, don't worry about it, Mom. Don't you have a test today? Yeah, whatever, teacher doesn't really care. You want them to have a little anxiety. At the same time, you don't want the night before the child is shaking and irritable and upset and can't focus and can't function because their test anxiety is so severe. You want your child to be competitive, but you don't want them to be scared. Well, what if I lose? What if I don't win? What's going to happen? You want that energy. You want them not wanting to miss material in class, but when you go to the doctor's appointment and they start to get so anxious, but what am I going to do? Where am I going to get my notes? I'm going to miss that class, and then my grades are going to be terrible, and my teacher's going to get upset at me. That's where it's going to be problematic. You want them hesitant around strangers, but when they go visit their aunt, uncle, cousins, other family members, friends, you want them to be comfortable. You want them not to have so much anxiety that they can't. Let's talk about today's talk, right? If I didn't have any anxiety before today's talk, that would be problematic, perhaps. I would come in here and sort of wing it. But the anxiety helps me. I embraced anxiety. And yes, I was anxious before today's talk. And most often you actually know is that people have some level of anticipatory anxiety. You can actually ask performers. Most performers, actors, actresses, they will tell you. Unfortunately, a lot of them are using other substances to help their anxiety to increase their performance, rather than learning effective strategies and skills to be able to regulate and tolerate their anxiety. As we know, it says in Hillel, Ashe Adam Mefachi Tamid. What does that mean? It means praised is a man who's constantly scared and worried. How could we praise someone who has anxiety constantly? And the answer to that is that praise is that person because they will stick to their values, to the Torah, to their morals. Because they have that level of fear and anxiety to a degree, it's going to help them do what they need to do and do the right thing. So we all want some of that anxiety, but sometimes it can become problematic. So we really have to understand, as you look at your children, what is developmentally appropriate, what is normal, when does it become impaired, and really be patient with your child. Because a lot of times anxiety emerges, and it's okay. I have people frequently come to me, for consultations, or maybe, isn't this a problem? I'm like, just let it be. I said, when they're 30 years old, I don't think they're going to be going under their bed when there's a thunderstorm. Okay? But perhaps we'll talk about it might be more impairing than that. But it doesn't necessarily mean just because they're having some anxiety developmentally, which is normal. So we have to know what's normative based on their age, and much of this is transient, and it's not disordered, and that's the key word. It's anxiety, it's not disordered anxiety. So infants have a fear of separation, they have fear of strangers, right? Most kids, the first time you take them to playgroup, they're going to have some anxiety. Some kids won't, and that's okay. But there will be kids, I know some of you are thinking, not my kid. You're thinking one of those children who's just ran off at age 3, we're having an amusement park and being friends with some man on the side, and your anxiety is, getting really high. Young children have fear of dark, animals, water. Children fear robbers and kidnappers. In teenage years, it's normal to have a certain self-consciousness, a certain level of social anxiety. We can see with our young children, we just had Purim, right? How many children get fearful of costumes and masks, right? That doesn't mean you need to bring them for therapy or you need to get them on medication. A lot of that will pass, but it can become impaired, as we'll talk about. In new environments, they will cling to you. I've seen, sometimes children will be scared of certain story tapes that are scary and play with, and sometimes that child will be more fearful than the other children. And I once, I remember a case where this is more severe, more impaired. The child was fearful of thunderstorms, but every day would ask the parent what the weather's going to be, and wouldn't want to go to school. And if it was cloudy, would want to stay home. So that's where it becomes disordered and impaired. So when the fears are normal, that's okay. And we're going to talk about how to embrace and allow them to feel their emotions. You don't have to get anxiety that they have anxiety. Because if you're going to react to their anxiety and make like this is not normal, then they're going to get more anxious because they're going to think something is wrong. So we have to understand what's normal, what's not normal. And so the real litmus test for you to think about, it becomes a problem when it impairs functioning. Okay, and impairs functioning means, the child is, as I said, won't go to school, the child is not going out with their friends, the child is obsessively asking for reassurance over and over, everything they're worried about. It comes to a degree, it's affecting them socially, academically, it's impairing their sleep. If it's to that degree of impaired functioning, that's when you want to think about, we need something more. Older children also, ages 10 to 14, may be spending more time by themselves. They may appear sad due to be socially anxious or overwhelmed. So these children often don't get attention, especially schools or parents. They don't realize. They see like this withdrawal. With a young child, you can see it behaviorally, but with an adolescent, you're like, oh, she's going through a stage. I went through that stage too. But very often underlying that can be some anxiety. So how prevalent are anxiety disorders? Well, it is the most common psychiatric disorder in children, and it's up there in adults also. So estimate between 5.7 and 12.8%, which means approximately 10, probably 8-9% of children, and that's clinically, that's meeting DSM criteria of having a disorder. So that means in every class from approximately about 30 children, 2 to 3 of children in the classroom have a diagnosable anxiety disorder. However, up to 30% of children have subclinical levels of anxiety that might be impaired or problematic. So this is very prevalent, and anxiety symptoms do worsen over time. They do change, right? So they'll come out differently as the development changes in a child, and prognosis is poor with anxiety if it's not addressed, if there's not intervention. That doesn't mean every child needs intervention from a therapist or a psychiatrist or a psychologist. That's not what it means, but intervention is really important. Anxiety is more common in girls and women as well. It's more prevalent than in men, but don't worry, men have other more prevalent disorders that are more common by them. So anxious children, again, might be ideal students. They might not have behavioral problems. They might be just perfect and a little too perfect. And that's something to, we will talk about and look at. So I'm not going to spend too much time on this slide because I want to move forward. But this is specific disorders in anxiety, specific phobia. That means people have a phobia to something specific, like I mentioned doctors, needles, blood, flying. You have a very specific phobia to something. I just want to, as I go through these criteria of diagnosis, something I write in my book in general, in parenting, a diagnosis tells us what he has, not who he is, which is really important. We're not labeling children. It's a cluster of symptoms so that we can understand what they're experiencing, but they are not their the disorder, which is something that's important for perspective. Separation anxiety, that's where a child's missing days of school, fear of being lost, parents will be harmed, doesn't want to be left alone. They're the ones who are scared to go to camp, obviously go to school, to a new friend's house, to a new experience. Generalized anxiety is just excessive worrying about grades, something bad will happen. Social anxiety is fear of being rejected, embarrassed, put down in some way. And that can actually lead to people, even in our community, when it comes up to the Torah, they won't go and say the bracha, they will avoid it. Or in a social situation, you have a simcha of some sort, the children will not want to go to a bar or bar mitzvah, they will stand on the side, or they'll avoid those situations. OCD are repetitive ritualistic behaviors. They have a just right feeling, they do right, they're scared of contamination, there can be lots of forms of obsessive compulsive disorder. Mostly kids will not share. So in OCD, that's very much could be internal, and you might have no idea. Even as a clinician, when we actually treat OCD, we find out the person doesn't even realize their rituals and their compulsions and their obsessions. When we actually go through a process and we assess that, they become more aware of that. And panic. And panic is when you have physical symptoms of anxiety, they become so intense, and that leads you to a state of panic. So really a lot of this comes in different developmental stages, and a child can have a number of these. It doesn't have to be one specific anxiety. So CDC, I feel like since COVID, everyone knows what that is. So the CDC says it's interesting if you see this data. If you look, is that behavioral disorders, we see those emerging really, really on, even more so than anxiety from 3 to 11. You don't even notice that. We notice the oppositional defiant behavior. We notice the ADHD. We notice the impulsivity, the difficulty listening and noncompliance, the fighting, the bullying. Those things we notice, but we don't necessarily notice till they're older or get a handle. Really underlying that can often be anxiety. But clearly, anxiety at the end of the day, as you see over time, between 12 and 17, is the most significant. And I remember there was one family that once came to me, and there was a lot of anxiety in the family. And the child was now in 12th grade. And they're like, this kid was, like, we all have anxiety, but he never had anxiety. And, and really it's possible. And we know that the onset of anxiety could start in adolescence. It can start in adolescence, early adulthood, even in adults. We saw even like postpartum can activate anxiety or emerge. So it can happen later in life. Usually, obviously, by 20s, 30s, you already have some idea that anxiety is emerging. So where does anxiety come from? Why do some people struggle more than others? Just to give you an understanding a little bit about the etiology. So there's biological disorders or neurotransmitters. This is the GABA, the serotonin, perhaps dopamine plays a role. And this is where we clearly see that there is a chemical, we see that this is actually runs in families. There's a genetic component as well. So it's biological, and then there's also in terms of the neurochemistry, but it also in terms of the families. I recently had parents come to guidance regarding a 5-year-old. The 5-year-old kept saying, excuse me, every so often. I think every time they refer or they guest kept saying, excuse me. And even though the parent was like, hey, you don't have to say that every time. And they wanted to know, was it a tic disorder or was it like an obsessive compulsive? They were trying to tease out. So I turned to mom and I said, do you ever do that? Say so much? No, anxiety. And she's like, I don't know. And then her husband's like, turns to her and says, yes. She actually repeated words also. Very, very, not from modeling, but it seems like the child just was emerging some anxiety as well. Deficient social supports, family dysfunction, trauma, chronic environmental stress. So with the biology, it can emerge because there could be precipitating factors that actually cause. That's why sometimes it will come out later in life for different reasons. We know that more of 2/3 of children, I don't think this is in our communities, but reported at least one traumatic event by age 16. A traumatic event that was really, really significant, like physical sexual abuse, school violence, domestic violence, national disasters of some sort. In our communities, of course, we have this as well. I don't know if those are accurate numbers, but clearly those traumatic events with the biology can create that problem. So the question was brought up, so what do I do? Like, how do I make sure my child doesn't develop these anxiety disorders? How do I make sure they don't struggle? What can I do now? Even if my children are younger or older, and I want to ensure that these things don't happen. And there are a lot of things we can do to protect our children. It's not obviously not a guarantee. So even if they're genetically loaded or they were exposed to some trauma, that doesn't mean that they will develop an anxiety disorder. And there are things that means they might have some anxiety tendencies, they might be emotional sensitive, they might be reactive, but that doesn't mean it will become disordered or problematic. So what can we do? We can build strengths. And we can build resilience in our children to be able to deal with difficulties in their lives so they can actually bounce back. And this is the power of you, the power of a parent. You mean so much to your kids, and just being present and mindful and being in your child's life and giving your child time. That in itself will make them be able to deal with emotional struggles and difficulties. The single most common factor for children who develop resilience is at least one stable and committed develop relationship with a supportive parent, caregiver, and this is clear across the research. You can ask Google, AI, I think it will all come out very clearly that having stability of at least one supportive parent actually builds resilience in children. A lot of times we see the children who struggle in society is because they don't have those caregivers as they grow up. Social supports, religiosity, problem-solving skills, allowing children to learn to problem-solve, helping them with, willingness to verbalize and express themselves, so that children don't feel understood, and obviously treatment are all protective factors. If you get treatment earlier, you're going to do better. I think the problem is that a lot of children were not aware that they're anxious, or they're in the school, and the school is not picking up on their anxiety, and they're not getting treated, and they're not getting supported, and they're struggling alone internally, and therefore they're not getting the help, and that leads to more problems. So if we could be mindful parents, we can be aware of emotional expression, we can understand, we can validate, we can connect. These are a lot of skills and strategies where I break down in my book practical strategies on how to validate and connect and be mindful with your children. So when is professional intervention indicated? Here are just some examples of what you mentioned earlier: academic performance, school refusal, social withdrawal, complaints of constant illness. So with kids, right, they're complaining of headaches, stomach aches. They're not able to verbalize that I have anxiety per se, but if they're frequent visits to the nurse, to the doctor, all those sort of issues. If you're seeing a mood change, mood disturbance, or if you're overwhelmed, you as a parent, that's the time for treatment. So if you feel you cannot deal with your child's anxiety and you're overwhelmed, then you might need some help helping your child, or perhaps bringing your child to get treatment. Sometimes you might think the child's not doing well in school and they're having difficulty with focus. That could be anxiety. It's not necessarily a focusing issue or a learning issue, because anxiety can affect the ability, it affects the executive functioning part of the brain. Younger children are more amenable and willing to get help as we get them older. As they're older and they're adolescents and teenagers, they're less willing. So we want to try to identify it early on. I remember an example, there was a teen who was really struggling in school. He was being somewhat delinquent, kept complaining, wanted to use the bathroom constantly, tissues, and they thought the kid was like opposite. He was extremely into his hair and his look and changing his clothing, and it was actually identified over time that he was struggling with a lot of anxiety and worry and social anxiety. He started on medication, and the result of a free child. It's not always the case, but clearly that can be. So let's get into the treatment. So cognitive behavioral therapy is an evidence-based therapy. A major research study found that a combination of CBT with medication or antidepressants worked best for children between the age of 7 and 17, rather than a child with one or the other. But I would tell you is, generally what I suggest is, sometimes a child is not willing to go for treatment, I would say maybe start with some medication with your pediatrician or psychiatrist. But if they are willing to go for therapy and they haven't tried therapy yet, I usually recommend starting with therapy. And many kids, if they're willing and they're open and they want to do the work and the therapist is able to engage them, you can actually see a tremendous amount of progress. So there's psychoeducation, cognitive techniques, relaxation, exposure. I will explain what all these things are. And family treatment, parent training, which is a little bit what we're doing today. But I mentioned to someone earlier, in our group practice, we have a 6-part series of moms that they come every week to learn skills and strategies to help their child with anxiety. So we found that even to be more effective than having the child go alone, because the parent who has connection or relationship with the child is able to understand the techniques and help them implement those techniques. Is far more effective than sitting for months and months of therapy. And the mom's also obviously connected and their own anxiety is coming up, and it's a powerful, and then family therapy can be effective too, and psychopharmacology. That's SSRIs, mostly that Zoloft, Lexapro, Prozac, those have shown to be very effective for children with anxiety. Okay, so let's understand a little bit of anxiety and the treatment, what goes on. So I want you to imagine you walking down the block and you see this German Shepherd just lunging at you, jumping at you. What's going through your mind? Someone, what are you thinking? Run. Okay? Okay, you're thinking, or you might have the thought, oh no, I'm gonna get hurt, right? So immediately, there's an activating situation. The immediate fear response is there's a primary threat, and you have this heightened attention to threat. So what happens is, in that moment, are you thinking about what you're having for dinner, or where you're going out with your friends tonight? No way. Your focus is completely focused on that German Shepherd jumping right at you, right there. That immediate fear response. Now, once you're in that response, once you're in anxiety response, then you get in a state of anxiety. And then this is like a second stage. You actually start to get preoccupied with the anxiety itself. Now, can you imagine if you hear something late at night, you hear a noise, and you wake up startled. And then you hear another noise. You're gonna even be more anxious, right? Now, if you heard that first noise, you would say, oh, that's probably wouldn't hear it. Oh, that's the AC going on. It wouldn't bother you. But once you get into that state of anxiety, it's important to understand with children, is that once they're triggered, then they become preoccupied with the anxiety and the emotion. And from that appraisal, that's a secondary. So first I see the dog, I get scared. Then I see the dog in a scared state. So now the dog's a monster. Before was a dog, that was jumping on me. Now it's a monster jumping on me because it becomes even scarier. And that's where I have 3 primary responses. One is behavioral, which is run. That's the fight, flight, freeze response, where I either freeze, and that was there to help us avoid detection. There's a reason why our bodies do that. Or if something's coming at us and we just freeze automatically, can help us. Run, or attack, or fight, right? That's what we do on the, when we're out there at war, right? So when the soldiers are there, they have those automatic responses. So that's behavioral, that's the action. The emotion is the fear, the anxiety, the terror, and the physiological is what we feel in our bodies. It's really important because we want to break this up for our children to understand that there are different aspects. There's the action, there's the emotion, and then there's the physiological. That's when our hearts are palpitating, we're sweating, crying, we feel whatever we're feeling going on in our body, the muscle tension, things like that. So what do we want to do? What we want to do is we want to decrease the overestimation of danger. So we look at this threat as high probability. Severity of negative outcome is really hard. Something will go wrong and it will be a disaster, right? So Sammy doesn't do his homework. So immediately he doesn't do homework, then he starts worrying, will the teacher get upset at him? And before you know it, he thinks, that's it. School's over. He's going to fail the whole class, right? And he starts to see it as a complete catastrophe. So firstly, we want to help them to decrease that catastrophizing, that danger and threat, and being so preoccupied. And the other thing is, we want to increase the other ways, the underestimation of internal external resources to cope. So when we have anxiety, you're sitting there with the dog at you, you're thinking, not only is the dog about to get out and kill me, and I'm going to end up in the hospital,
I don't even think I can deal with this dog if it's coming at me. What am I going to do? I don't have the capabilities. So we really want to help, whether anyone with a dog or we want to help Sammy realize you can cope with this. We want to help him, first of all, decrease his belief that this is so threatening and so horrible and I can't deal with this. And at the same time, we wanted to increase his abilities that I can deal with this. I can cope. Even worst case scenario, I can cope and I can deal with this. So here's a list. I'm not going to go through this list. It's in your slides. But these are a lot of the physiological and behavioral signs of anxiety. So if you want to know if your child is struggling with anxiety, these are typical symptoms and physical symptoms. And sometimes they become anxious about these symptoms. So if you can help them know this is part of anxiety, this is your alarm system, this is normal, that's already going to decrease the anxiety. Because that's what happens in panic. I get anxious about my anxious. And then I'm going to think I'm going to die, I'm going to lose control, and that's where I have a full-blown panic attack. Yes?
I have a question.
Please.
Okay, so my daughter's in 5th grade, so middle school is very different when it comes to like not being late and you like get detention because that's the newest thing. So what's like a typical anxiety of like my daughter will lose her mind if she misses the bus because if she'll go crazy because one time she was almost missing the bus but then I had to take her and then she was late and then from there she thought, oh no, I'm late, now I'm so close to getting detention. You're only allowed to get like say 3 latenesses or something. Like what's is that normal typical anxiety over this? What's going to happen if I get, I'll get detention, I'm going to get in trouble, is that typical normal stuff in middle school, or is that something like, I should like talk her through, like, I kind of wanted to react and maybe, get that late and then see actually it's not terrible, she even gets detention.
Well, let's say
Like,
she doesn't ever get there.
But
Right.
honestly, I feel like if it's better just to, so
Yeah.
it's not, I think it's the anxiety of just getting the detention.
Right. I mean, that's a great example on maybe a role play, how you can respond to it sometime.
About the role play.
Yeah, because they're looking for that opportunity. So where's your anxiety right now?
The role play is very high.
Okay. So right now, your daughter, it's that situation that happened. She thought it as threat and danger, and then she's already overestimating, like, oh my gosh, this is going to be so horrible, and she doesn't believe she can deal with it, and that's perfectly invalid that I just mentioned. But everything we just learned, is that normal? Well, the answer is if she's an anxious tendency, she's an emotionally sensitive child, and that happens like once in a while, and then she's able to bounce back and move on, and it's not impairing her, it's okay. She can have some anxiety. Yeah. That's it. However, if you find that every school morning or once a week, it's really getting in the way because or you have to go to an appointment and you're going to be a little bit late and she's, like you described, she's getting so overwhelmed, then it would be more problematic. So we'll talk, now we're going to move into how you can help your daughter.
I just kind of want to expose her to detention so it's not the scariest thing.
Yeah, so we're going to talk about exposure, and that's a form of treatment, but exposure doesn't work like just, here, go to detention, and then, oh, now I'm exposed, it's not so bad. It's like I had someone came to me, it was like, he had a fear of driving on the highways. And he's like, don't give me this exposure thing, okay? I know about exposure therapy. I've been driving on the highway for work every single day, and I'm freaking out, right? So as I sort of assess it with this person, yes, they drive on the highway in the right lane, looking at the mirror every 3 seconds, keeping their phone really close to them, making sure there's no disturbance or music on them, and by the way, both hands on the wheel. You don't have to tell them, and their knuckles are white. Okay, so clearly, yeah, they're doing exposure, but they don't want to be there. So if we're taking our child and sticking them into detention and they're, freaking out, that's not effective exposure, as we'll talk about. Okay, so, as I said, what are we doing in CBT for anxiety disorder? We want to help the child understand this internal alarm, right? This is smoke alarm that we get. What happens in school? So the children are in school, and then the fire alarm goes off. Okay, so a bunch of the kids there, they were all told there's going to be a fire drill today, so they're all walking out and they're not really worried about it. So really, because they understand it's a false alarm. Children who have anxiety are seeing everything as a real alarm. It's a real threat, or it's danger. We tell children is that sometimes the alarm is activated and goes off and it's really a false alarm. It's everything going on in your body is normal. It's good. This is exactly what's supposed to happen. It's just been triggered, and it's a false alarm. So we have to be able to check, is this a real alarm or false alarm, and then see how we can get, quiet down the alarm and move on. So we want to help them appraise danger. And that's what we want to see, is do we want to eliminate this or do we not? And cognitive therapy teaches people how to accurately appraise danger and become more aware of resources, as we talked about. And we see, are their fears accurate? We don't need help with stress management if their fears aren't accurate. Right? We're not going to problem solve, but first we have to see if they're accurate. So the goal is to decrease their perception of risk and increase resources. We want to give them tools, because let's say it is really dangerous. Let's say it is really stressful. What tools can we give them, coping tools, to build them and move forward? Because essentially, avoidance is toxic when threat isn't great. And this is, if I could keep one line, is that if we're going to avoid, because and your child's avoiding, and you're even maybe reinforcing the avoidance or allowing the avoidance, it's toxic. If I would tell you how many sessions over my career I worked on getting people off Klonopin and Valium and all these medications, because it's just a way of avoiding their emotions, and it's toxic. So it's really we want to address their helplessness by giving them tools. So there's this inverse relationship with risk-resource. So if the risk is high, you give them resources, the risk goes down. Okay? And if the risk is low, again, that also will have the anxiety go down. So let's talk about avoidance a little bit. Okay? So avoidance is, you have the stimulus, as we talked about. You have the dog. I'll go more on the dog. Then you have the anxiety. What do? You run. Okay, we ran away from the dog. By the way, the dog had like 4 fences, was chained on every side, but I ran, because I cannot even see the dog. I am so scared of that dog. So when I ran, what happens when I run away? It works. Exactly, it reinforces. Like people say, come on man, why am I doing this? Can I just drink? I'll drink a little bit every night, I'll do great. And I'll say the truth is, if you get a cheap bottle, it's cheaper than therapy. It's certainly more fast acting, right? Gets them good and strong. And it works. You're absolutely right. So, well, the answer is the long term is the problem, right? Short term, it would be fine. It's the long term that's going to destroy your liver and your relationships and your life over the long term. So, avoidance works. At the same time, though, it reinforces a process of avoidance. And then your child is further and further withdrawn and gets more and more anxious through that process. And avoidance, you start to generalize not to just the situation, to anxiety in general. Because anytime I feel uncomfortable, we don't like to feel uncomfortable. By the way, anxiety is extremely uncomfortable. I think most of us can have experienced it at some point in our lives. And people describe it as even painful. Like, they feel like it's horrific. And they just want relief, anything, to get that relief. So when I do something and then I avoid, and then it goes down, and I don't feel it, the anxiety goes down, depression goes up, relationship problems go up, other issues go up, even though the anxiety goes down. So to address anxiety symptoms, we have to find a way to eliminate avoidance and safety, and help them be able to expose themselves and go towards themselves. So here we got to the dog. Here's how it works. Okay, so there's Jack again, seeing the dog, and then he has the thought. Right, there's a thought in his mind. What does he think? That dog is going to bite me. What does he feel? The emotion of fear. What does he do? Run? Gets home, I'm safe, I feel great. But he's constantly worrying about the dog. Whenever there's a dog, he's constantly worrying. So it's this vicious cycle that goes around and around and around. Any questions so far? Okay. So what's the basic cognitive model? The basic CBT, and this is what we're going to move towards interventions to help your children and perhaps yourself. And this could work for you too, whether because it just has to be for your child. So you're in this situation, and someone can be in a situation that their child has anxiety about. Someone, I know we have that one for a little bit. Anyone give an example that they're stressed? Yes?
My 4-year-old will scream and cry every time I leave the house.
Every time you leave, everything. So the situation is mommy's leaving the house, right? Can I ask his first name?
She, and
She?
it's Esther.
Esther. Okay. And And Esther, what do you think Esther thinks in her mind as soon as mommy starts to leave? Esther's a little young.
She's young.
Yeah. But Esther, what might she think?
That I'll be gone a long time.
Exactly. I'll be gone a long time. It's not going to be safe. I need mommy. Something like that.
Yeah.
Which is going to... And therefore, because of that thought process, she's going to have a reaction. Emotional, sad, anxious, nervous, worried, behavioral, scream, yell, pull at you. You're like trying to like sneak out of the house before she even sees it. That's your avoidance, right? And then her physiological, right? And then, also everything that's going on in her body at that time. So what we see is all those reactions. Now there's another 4-year-old that mom leaves, and they're fine. What's going through that child's mind?
Mom will be back.
Right? Mom, do whatever. That's right. So that, who said that? That was good. That brings not only does it not bring anxiety, that brings joy. Right? The whole different emotional experience, just based on their perception. One's mom's leaving, danger, threat, preoccupied anxiety. Others, mom's leaving, party, right? Get the house. Finally, she's going to leave me alone and stop telling me to do my homework every 5 minutes. Right? I'm finally free. Relief, joy. What's her behavioral reaction? Run to the phone to call her friends. Come on, mom's not here. Let's have a good time, So that's her behavioral, physiological response. But it's all based on that. So I'm going to ask you to do something with me. I'm going to ask you to look at the next slide. I'm going to ask you a question, and I want you to answer right away. I don't want you to think. Can you do that for me?
Yes.
Okay. What do cows drink?
No.
Cows.
Water.
Cows drink water, right? Why did we say that? So here you are. I asked you a question.
We're wired, your cows.
You have an association, correct? But immediately you have the thought in your head, that's milk, and you say milk, your behavioral reaction, which is not true. We can have a thought that can end up in our head. We can have a behavior, everything, a reaction based on something that's not accurate. So our children or ourselves, that we're seeing this threat and danger, and we're getting these cognitions, these thoughts that most often we're not aware of the thoughts that are going on, that are leading to our emotion and our behavioral response.
That's very like an error of perception.
Exactly. It's erroneous belief. It's a distortion of belief. And even, by the way, because someone's going to say to me at some point, well, it's true, right? Well, even if it's true, sometimes it's not helpful to think about it. Mommies, do kids, I'm nervous I'm going to get cancer. No, don't worry, honey, kids don't get cancer. Right, yeah, you can't do that, right? Because there's some truth to it. So even if the thought is true, first of all, perhaps they believe it more than it really is. They think because their neighbor, unfortunately, the child got sick, that means, they're going to get sick because they're neighbors, or they're next to each other. So because if one is sick, then the other is going to be sick. So that might not be. Or they believe the likelihood, right? They think the threat is so high when it's really much lower. The other thing, it's not really very effective, and you want to help them to walk around all day and worry about those things, right? Some people worry about health anxiety. I say to people when I treat health anxiety, I don't know if you ever heard on the news, I think it was maybe 80, one of these stations, I remember, I just as a therapist, it just caught my mind. They have this Princeton Longevity Center, right? This is a health anxiety, hypochondriasis dream. Basically, you go to this place, and they have every scan in the world. Like you could spend the entire day going there and getting top to bottom, blood workout, every type of doctor, every type of scan. It's great, right? So I say to that person, okay, let me ask you a question. Can I ask you a question? If you would go there every single day, would that decrease the likelihood of you getting a severe sickness and increase the likelihood of you catching something really, really early? Yeah, I would assume so. I mean, we know God runs the world, but yeah, I would assume if I would actually do that every single day, so why not? Why not?
You're not living.
You're not living. Right? So even if the threat is there, right, you're not living. Does that mean you don't go to doctors? No. You have to find a balance. So even if there's a true threat, or there's something that doesn't necessarily mean it's an effective behavior, because there are other reasons or things that get in the way. Okay. Can I have another person from the crowd? Yes? I thought you were, yes? Can you? No?
Oh, do you need me for something?
Yes, I want some more. No problem, okay. I want you guys to feel what it likes to feel anxious. Please don't throw things at me. But as I actually call on you or something like that, notice the feeling in your body. Notice the apprehension. Notice the thought of, oh my God, why didn't you just pick on me? How do I look right now? Do I sound stupid? I just had a piece of that cherry cake. Where is it? Okay, anyway, so the question, I just want to interact with you a little bit more. Okay, so you have two kids. They're online to a roller coaster. What do you think the girl's feeling?
She's sweating.
She's sweating.
Panicking.
Panicking. So you feel panic, scared, fearful. The boy?
Psyched.
Excited. Awesome. Six Flags, my favorite roller coaster. Okay, so that's what they're feeling. What do you think she's thinking?
That something bad is going to happen to the mother.
Yeah, something bad's going to happen. I read an article last, someone showed me an Instagram post where this roller coaster fell off and, people died and something like
Or
that.
if it's even something as simple as I get dizzy when I go on one.
Yeah, and even that. And I get dizzy, and what's wrong with dizzy? I'm sorry? Okay, I'm going to get dizzy, it's going to, right, so that also might be an overestimation of danger. How long does dizziness last? Yeah, so likely not. So what is the boy thinking?
Just want to move faster.
Yeah, there's a boy, we found him. So, he's like, I want to throw him. Let's get this thing moved, right? So he's like, and how is he walking? What's he doing? He's walking quickly, or he's looking. If no one's looking, can he, get around? And she's like, walking this way, and really, really scared. So is the roller coaster different for each child? No, it's the same roller coaster. It's all about perception. It's all about their glasses. It's all about the lens and how they're viewing the situation. What would the boy tell the girl? What do you think he could tell the girl?
It'll be fine, don't worry.
Yeah. Usually that doesn't help much when people are worried. He's like, just don't worry. He said, yes, I want to be worried. It's exactly what I want. But he might say to her something like, I've been on this ride like 6 times. I'm telling you, it's awesome. Like, you don't get dizzy. You get dizzy for like 5 minutes. It's not a big deal. So he's like whispering in her ear, and then she's like hearing him. I think that's how I got on my first roller coaster. Someone like just totally pushed me on. And then I continued. So that's essentially what we're doing in cognitive therapy. We're being aware of our thought process and being a detective in our thought process, and then learning how to respond with alternative ways of thinking, and teaching the individual, the child, to think differently, because when we think differently, we feel differently, and it decreases the emotion. How many?
So can I just ask
Yes.
a question? I happen to, this is a good example, I have a child that literally does not have anxiety about anything. She won't go on a roller coaster. But she has no anxiety with anything else, so do I try and work on it, or like, who cares?
Right, it's a great question. I would say she probably does have anxiety in other areas, but it's not impairing. This is something that's really significant and obvious. You might be a more carefree child, but if you were away and someone came in the middle of the night and started banging down the door, she has anxiety. Okay, she has that threat system. Okay, so the question is, so the example I give is, what happens if someone goes to some safari in Africa and they come back to me and they say, I need therapy. I saw this type of insect. I am so scared of that insect. Like it freaked the living daylights out of me. So I said to them, do you plan on going back to safari again? No, but I was so scared of that bug. It's like, I'm freaked out by it. Do you ever plan on going again? No. Does that bug, is it in, this area? No. Get out of here. Right? So you're not going to be, so really it's not impairing it. It's not affecting it. So let's say she doesn't like roller coasters. So she doesn't like roller coasters. Now, again, if she's, how old is your daughter now?
9.
No. Now, if she's 12 and all her friends are going on a trip, and she starts to feel socially disconnected because all her friends are thrill junkies, and she just wants to be able to go on a roller coaster, then it's starting to impair her. But if she goes and she doesn't mind taking, if you have younger ones on the merry-go-round and doing all those other stuff and getting something good to eat and that works for her, it's fine. right? It's only if it, so I don't think you necessarily have to actively work on that. So, where's Lauren? Is she here? How am I doing on time? I can keep going. No, I mean, I have more content. Can I keep going? I'm asking. Okay. So there are a lot of common thinking errors that are characteristic for anxiety thinking. I mentioned them. There are two primary ones. One is catastrophizing, where we make everything a catastrophe. Something bad will definitely happen. It will be horrible. Actually, research shows something fascinating about worry. About 85% of the things that we worry about do not occur. They've studied this. 85% of the things you worry about. You notice all the other things you didn't worry about, and they're like, oh, I should have worried about that. Then I wouldn't have a problem. It doesn't work like that. That's called magical thinking. And so we think if we worry about something, then we're not going to have that problem. That sounds like, back in Europe, they told me, if you just keep worrying, Jewish mom worrying, and that's going to save your children. So that, and the other thing is that if that actually thing happens, because I've seen it. This is what I do. There are cases where people were scared of getting ill and they got seriously ill, right? 79% of those people that it actually happened, close to 80%, actually coped far better than they ever imagined. So firstly, it's highly unlikely, and even if it happens, they realize that they can cope and deal with it. They think it's going to be some terrible, horrible disaster and they're not going to get through it. They actually cope significantly better than they ever imagined. And the other thing which I talk about is overestimating threat and danger. And those two really come into play. I'm actually going to skip this slide. You have it. Basically, these are the underpinnings of anxiety disorder. These are underlying belief systems. I'll just go through one so you can understand what it means. Let's say intolerance of uncertainty. That underlines that belief system, fear of not knowing for sure, right? We can't have certainty. It's impossible to have certainty. A lot of what we do in therapy is helping people learn to embrace and accept uncertainty and become comfortable with being uncomfortable, being comfortable with uncertainty. So when I have that usually underlines generalized anxiety disorder, OCD, and illness anxiety disorder. Or usually underlying that is this need for certainty. So it might be interesting if you want to see some underlying belief system and underpinnings of different anxiety disorders, just because of time. So we talked about cognitive behavioral therapy. So we started to talk about the cognitive aspect, and I want to tell you about the behavioral aspect. So these are some of the cognitive interventions that we use. First is psychoeducation, which I gave you a ton of today, which already is a lot of what we do in therapy. You could teach your child about the alarm system, about the behaviors, about their emotions, about anxiety, about it's normal, it's there to protect you, it's the threat and danger response, right? And then anxiety comes and goes. It doesn't stay forever. It's an emotion, it's a feeling. We feel it in our bodies. So giving that knowledge and that understanding of what, and the ability to label is helping them understand themselves and get less anxious. Examining evidence for and against, which I'll talk to you a little bit about this. And this is where we become a detective. We teach children to be aware of their thinking process and start to question their thinking process to have more information. Decatastrophizing. So that's where we actually help them look at the worst case scenario. Like, what's going to happen? You know what happens in your brain when you're anxious? You think about, like, oh my gosh, is there going to be I'm going to get into a car accident. And then you stop. And you just see it as a catastrophe. But you don't think about, well, likely if I get into a car accident, what can happen to me? Can I get myself better? I'll have to go through some rehab, whatever it might be. I don't know if it's a great example. But basically, decatastrophizing that scenario. We look at advantage, disadvantages. Let's say a child has OCD or perfectionism. We help them see what's the pros and cons of perfectionism. How does it help you? How does it hurt you? And by doing that, we're being able to change the way they think. Behavioral experiments, we tell them, you know what? What I want you to do for your exam, I want you to study less. I want you to study for this exam for only 20 minutes. If you're crazy, I'm going to fail, it's going to be disastrous. We're going to do this as an experiment. Right? So you're not going to tell your child, I want you to run in the street without a helmet and see that cars won't hit you. Right? So obviously it has to be something that, likely the outcome will be good. And that even if the outcome is not as good, she doesn't do so well or he doesn't do so well on the test, that they can still cope with that outcome. And then mindfulness and acceptance is ability to be aware and feel and experience anxiety. I think as parents, we have to be mindful and aware of our own emotions, and that's a technique, how we actually stop judging our emotions and experiencing our emotions, and our thoughts, and allowing our thoughts to be there, and sensations, and coping statements, positive self-talk, self-encouragement. Those are cognitive interventions that we use. So let's talk about detective thinking. So who was that one with your daughter in detention, right? Okay, you can remember. Okay, are you okay if we're doing are you comfortable if we do a little
As long
open?
as I don't have to get up. Sure.
You do not have to get up, yeah. So what I'm going to do is I'm going to ask the questions to your daughter, onto you now. Again, for the purpose of demonstration, I'm not going to do developmental enough. Your daughter? How old is your daughter?
She's in 5th grade, she said.
Okay, so, okay, good. Okay, can you give me your first name? Are you comfortable with that?
Esther.
Esther, that's okay, that time of year, beautiful. Okay, so, Esther, I know you're really anxious about school and about going to detention, right?
It's not the school, it's just the detention. She
Detention.
doesn't want to get in trouble.
Okay, so what, right.
Oh, I'm Esther.
Oh, you're
Okay,
Esther.
sorry.
Yeah. You're Esther.
Okay. Oh, absolutely, Esther.
So what's wrong? Why don't you want to go to school?
I don't want to get detention. Detention is for bad kids and I'm not.
Okay, so you gave me your thoughts right away. Right, so some children won't even get her. She said it right away. That's her perception. Detention, go to detention is bad. Okay? So then I'm going to say, Esther, have you ever been in detention before?
No.
You never got into detention? No. So why are you scared you're going to go to detention? What evidence do you have that you're going to go to detention?
I don't know. I think it's fine. I've been to detention. It's not so bad.
Esther saying that?
No, I'm saying that. I don't know what her thoughts are because I don't see what's up. I don't see like.
Okay, right, it's hard for you to know. Does someone want to give an example with their child where, oh, okay, thank you. Is that Lottie, correct?
Yeah.
Yes.
So what about like my child?
Do you want to come up?
No.
I was going to try to see your house.
No, my child has a fear of, I don't know if it's dark, but like going to bed at night.
Okay. Okay, so how old's your child?
She's
Is she up?
up right now. She's probably.
Okay, is it okay if I'm just being sensitive. Is it okay if I do this role play with you? Okay. Okay. You can give me a different first name just for
No.
Okay, what's her first name?
Michelle.
Michelle. Okay. Michelle or Rochelle? Michelle. Okay. So Michelle is here. So why don't you start by complaining? Complaining. What's the problem?
Like what she was complaining.
What she was saying. What would Michelle say to me? I'm you.
Say, it's too dark in here, the shades are open,
So Michelle, so tell me a little bit. It sounds like you're really worried about something. Is that right? Are you worried?
yes.
Okay. What's going through your mind? You're scared? Good.
Say I'm scared of the dark,
You're
I'm
scared.
of being alone.
Right. So there's something about the dark that's scary. When you're in the dark, what goes through your mind? What are you thinking? What are you scared of?
Maybe she would say, I'm scared that, I don't know, I actually never asked.
Well, that might be a good place to start. Well, right? So, well, clearly, both of you are ready.
She just always says, I'm scared to get scared to
Right.
get into the dark.
So then the detective in you and teaching the person detective is like, so what happens when you're in the dark? Well, I don't know if they're boogeymen or Monsters Inc. or I don't know what. Or maybe it's like she heard a story, well, robbers come in the dark. That's what she said, that robbers come in the dark, right? So what makes you think there's a robber going to come? Has the robbers ever come into our house? Have you ever heard of a robber coming? So I'm using something called Socratic dialogue, where I'm not telling her what's happening, but I use this process of questioning. Is there another explanation? What's the worst going to happen? What's most likely to occur? What benefit is there to thinking this way? How is this affecting you? How could be the effect? What would be the effect if I thought differently? If your friend was scared of the dark, what would we tell them? Yes.
I'm
What?
not validating her feelings.
Okay, so that's first. This is a skill to just Validation is extremely important, and we'll talk about that in a little bit. Now tonight, I actually have a whole chapter on validation in my book, because that does help regulate emotion. But the first thing you would say, you would first validate, if you use that technique, and say, I see you're so scared. Now, when you validate, you don't validate the invalid, you validate the valid. So you don't have to validate that it's dangerous. You can validate that she's scared. You can validate that you were scared in the dark. You can validate that being in the dark could feel scary. You're not going to validate that being in the dark is dangerous or it's threatening. So that's the first thing you would do. And you would use this process. Am I being clear here in terms of the question? Yes.
Okay, so let's say your child is afraid of something that already happened.
Okay.
So it's like reinforcing the validity of the fact that they should be afraid of it because it already happened.
Okay, so give me an example.
Okay, so my son fainted in the summer. He felt dizzy and he fainted.
Right.
So now, months later, it's like, Ma, I'm feeling dizzy. Like, what if I faint again? Like, what happened today?
Okay, what's
Eli.
Eli?
Mm-hmm.
So Eli, what happens if you faint?
Then I'm gonna go to the hospital.
Okay. And then what happens if you go to the hospital?
Hospital's very scary.
Okay, what about hospitals so scary?
All the people, they have to do all these tests,
Okay.
and they test the blood, and
Eli, were you ever in the hospital? Were you ever in the hospital?
yes.
Yeah, when were you in the hospital?
What's
When were you in the hospital?
in the hospital in the summer?
In the summer? Okay, because you went to the hospital, something happened to her that she went to the hospital?
No, that's what I'm saying.
Oh,
no.
this is, he's
Sorry.
scared.
Yeah.
Okay, it's
yeah.
not about a sibling, he himself.
He fainted.
He fainted.
And he's,
He's
so
scared, he went down. Okay, and then what happened when you went for the test?
He was crazy from like, the poking and the prodding and all of that.
Okay,
And the need of the IV, everything.
Okay.
It was horrible.
yeah. So Eli, it was a really horrible experience, right? And you don't want to go to the hospital, I totally understand that, right? Did you get through it?
Yeah.
Yeah, it was really hard, but you did get through it. Do you think if it happened again, you would be able to get through it like it? Because we were really proud of you. You did a really great job. That was really hard. Do you think you'd be able to get through it again? Yeah. Yeah, and is it helpful to think about maybe I'm going to faint? Because that relaxes you, and that's going to keep you out of the hospital, right?
Probably not.
Probably not. So what's the effect of you thinking about, maybe I'm going to faint, maybe I'm going to faint, maybe I'm going to faint? What happens?
Right. I'm just worrying about it.
You're just worrying about it. So what might be a more effective way of thinking about this situation? Instead of thinking, oh no, maybe I'm going to faint again, and then I go to the hospital. So I'm just going to make it easier for you. So just the time, I'll take your question. So I would sort of come to the conclusion is that I did go to the hospital last time when I fainted. I got through it. It was rough, but I did a good job. At the same time, sitting here and worrying about it, we could talk about controlling worry. That's a whole discussion in itself. Okay, I can't teach that right now. But if I sit here stuck on that thought, it's not helping, it's just making me more anxious. So when the thought pops up, I'm going to just say, hey buddy, hey little worry monster, I'm not listening to you now. I'm going to play ball. I'm going to have a good time. So that's the process of questioning where I help them come to that conclusion. Okay? Yes?
Do you think that's effective with a 6 to 7-year-old, or do you think that's effective with a 4-year-old? I don't know how old their son is.
So mine's 87.
Yeah.
Maybe 7, I can see that.
Yeah,
Maybe 4.
so with 4, you're going to use a lot of behavioral strategies, not cognitive strategies, which I didn't get into yet. But you're going to use a lot of relaxation and other-based strategies for a 4-year-old because they don't have the ability to have that cognition. At the same time, I do remember once, I think it was about 4, this kid was like scared that if you flush the toilet, right? And you can do exposure with a 4-year-old too, by the way. If you flush the toilet, he's going to go down the toilet. And he was like petrified because maybe he's going to fall in. So I sort of did cognitive work a little bit. I said, really? That's super scary. That means I shouldn't have flushed toilets. I said, I'm so scared. There's a toilet here, should I try? No, I don't know if I try. And then whatever, I went through this process, then I flushed it on. I'm like, oh no. And the kids are, no, it's okay, you're gonna be okay. Right? So I used that as a way to talk back to the fear and to realize, and then we repeatedly flushed toilets together to see again and again. That was more behavioral, more exposure. Yes.
What about similar to her, like if your child is afraid of something that kind of happens, like my son is very afraid of dogs, and now he had a friend and he loved going there, and so they got a dog, and he could come to my house, I'm not going there.
Yeah.
Got him to go there.
Yeah.
It was the summer. The friend knew he was coming. He goes and it's the summer, what do you do in the summer? You go to your friend's back
Yeah.
back fence, like you go into the backyard. The dog was there, they didn't put it away, they didn't know, and the dog ran, and he was so scared, the dog fell on him. So he thinks the dog attacked him. So now every new friend he makes, do they have a dog? If they have a dog, I'm not going. So what do I do? I'm just friends only with people that don't have dogs.
Right. You know, that might work. That might work. But he might be like a social outcast. You know,
No, he
maybe
just
everyone has
like,
dogs.
whatever.
So the answer to that is, again, I think a lot of that's, we'll talk about exposure and helping him psychoeducation to how exposure is effective and making steps towards exposure, and also helping him reframe that experience. That his thing is, dog was attacking and killing me. And
The dog fell on him.
right,
That's
fall,
all. So
right,
scared.
right. So you're gonna say, no, the dog didn't attack you, it just fell on you. Oh wow, that's what it was. Thanks so much. I feel so much better. No, that's not happening. What I'm talking about, you're like thinking, no, that's not good. What I'm talking about, I'm using a process to help him, using technique to come to that conclusion on his own, and then be able to do exposure, behavioral exposure. So let's jump into exposure. Okay, these are different behavioral, this is going younger and older also. Vivo exposure means actual exposure, imaginal exposure. We could use our mind for exposure, interoceptive exposure. People have panic attacks, guess what I do? And they pay all that money to sit here, and I make them have a panic attack. So I actually bring on panic attacks so that they can actually have full-blown panic attacks in my session and be able to see that they can actually cope and deal with panic attacks. And then response prevention, social skills training, because if someone has so avoidant, so anxious, they don't learn social skills, they don't practice skills, and relaxation, that's progressive muscle relaxation, visualization, imagery, abdominal breathing, relaxation, lots of techniques and strategies that you can do with your child or themselves. And of course, I can't get into all that. So let's talk about exposure. Maybe that was some exposure. I see something turning away. Just seeing that big spider on her face. Okay. Collaboration is essential. Goes back to mom wants to put her child in detention to show her detention is not bad. That doesn't sound like a collaborative process. Exposure is done collaboratively. You build a hierarchy and you try to eliminate any safety avoidant behaviors is a form of exposure. So I talked about the guy driving on the highway. If he's actually checking his phone every 5 minutes or looking back, that's a safety behavior. We want to eliminate safety behavior. The higher emotion, the more effective the exposure. I can't get into this whole, this is actually Michelle Krask, probably the last decade, did a lot of research in exposure and actually learned that we need to create such an emotionally intense exposure to inhibit previous learning. It's called the inhibitory learning model. Is that where did I get scared? I got scared when the dog jumped on me. So if I'm going to start with a small step, just touch the dog, which could work, and probably good with a child, but if I would actually get him to do exposure and have one dog there and then spontaneously have three dogs come at the same time, collaboratively, that can raise the emotion so much and they can learn, wow, I'm here, I'm alive, still working, and actually could lead to desensitization. So we know that from, we test beliefs through doing that, we test the beliefs, and we discuss, we write the conclusions. So we want the anxiety to rise in exposure until it comes down. We want to be sympathetic, yet we want to be firm. We want to, basically in exposure, you want to explain to your child like this. Okay, I'm going to move a little bit faster and skip some slides, but I'm going to give you some points that will be helpful. If you ever go swimming, go swimming in the summer, right? You go to a pool, and let's say the heat just, there's no heat, the heat broke, and it's a little cold. So you go to the pool, and it's cold. And you're so uncomfortable, what do? Get out, right? Get out. And then he said, I'm going to go back in a half hour. What happens when you go back in a half hour? It's still cold. What happens if I stay in the pool? Right? I desensitize. I habituate, right? So we give these sort of metaphors and examples to children to help them understand that by staying in the situation and allowing yourself to experience it, you actually become more comfortable with it over time. There are lots of examples of that. So we try to build a hierarchy, even though, step by step. So here's the dark, right? So here's the dark. So stay in the dark room for 5 minutes, dim the light. Stay in the dark 5 minutes during the day. Stay in the dark room for 5 minutes during the night. Moving up that hierarchy of exposure slowly, one after the next, and that actually helps you help the child slowly habituate and desensitize to the anxiety. You want to be creative. You want to tweak as needed. Exposure is not such an easy process. It has to be collaborative. You want to push them. The higher the rung, the better, obviously, but doing it slow. Let's say the child didn't want to go to a new child's house, right? The first time I'm going to go with you, but you're collaborating with the child. We're going to help you get over this. We're going to do this. We're going to make a ladder, make it exciting. We're going to reward you every time you do your exposures. And you're going to help them learn. I'm going to skip this. It's about school involvement and why school is important, but we're going to move on. Okay, here's some other helpful strategies when you're dealing with a child with anxiety. So firstly is labeling. That's the validation. That's labeling their emotion. Just labeling their emotion and helping them understand that their tummy aches, that their headaches are part of your anxiety. That's okay. That's normal. Describe to them. There was actually a research study that was done with college students. They saw them this traumatic video. One group was allowed to explain and describe their emotions and feelings. One was given silly words. 48 hours later, both were able to do it, express emotion and feeling. The group that initially was able to express their feeling, their emotions were far less intense. The group that did not, and just said silly words, had more emotion. Which we see is that just the ability to acknowledge and validate and express your emotion actually decreases the intensity of emotion, even when you're talking back or having a fear of some sort of experience. Yes?
Do you feel that labeling it as anxiety might make them label themselves as anxious?
Yes, I talked about that earlier. Is if you're making it as, it's not you, it's an emotion. Sometimes you're sad, sometimes you're angry, sometimes you're embarrassed. It's an emotion. This is anxiety, if you like. You're not one big ball of anxiety. You're Esther, who's having some anxiety right now. So it's really about how you present it. Normalize anxiety, validate the valid as I talked about, provide reassurance when appropriate. And this is the problem, is providing too much reassurance becomes problematic because the child constantly seeks reassurance. So that idea is to actually, if it's minimal, the first time, the second time, giving them reassurance, it's going to be okay, mommy's here for you, daddy's here for you, we're going to help you through this. Helping them gently approach and not avoid with exposure and reward their efforts. So here are some very specific strategies. Remember, you said start with validate, right? So help them acknowledge, normalize, validate, provide some reassurance, and then help them gently move to it. So if your child's having a little anxiety over something that just happened, you could use these steps. You don't have to go through a whole treatment process. You can just use these steps. Unhelpful strategies. Excessive reassurance. It's going to be okay. Don't worry, it's going to be okay. I told you it's going to be okay. Yes, yes, everyone's going to be okay. Because every time you do that, what happens? Their anxiety goes down. They feel better, right? And then what happens? The thought comes back. And then they go back to you. You're their drug. You're their alcohol. You're going to make them feel better, but they're not learning to habituate or regulate or understand their anxiety. It's like a Band-Aid. It's not helping the problem. Or you're being too involved or directive. And you're giving them special, the child at night. The child's not going to sleep at night, or it's dark, right? So when you do come into mommy's room, stay with, right? So when you're giving them special permission because of their fear, and then you're going to see be the therapist 4 years later, how many times have I seen this? My child's too big, he's got to get out of my bed, she's got to get out of my bed, it's just not okay, right? But they started this process of special permission and avoidance because it wasn't addressed, and that actually created more problems. Yes?
So in this dark scenario, would giving them a nightlight be beneficial, or would it be like enabling them?
That's a great question, right? My kids have no nightlights, only dark rooms.
Yeah, so like none of those were an option.
So the answer is, of course, it's all about balance, okay? So yeah, as I said, children developmentally are more scared at night. That's okay. And if it's not impairing, and you put a little nightlight, and that helps them calm down as they develop, and they get, that's fine. But if the child, even with the nightlight, is just so frantic, or you have, you go away in a hotel and the bathroom light is on, but you can even pack the nightlight and the noise machine and all the other things you have to pack. Do they just like not sleep the entire night or in full fit? Then you know that it's more impaired. Yes.
So are you saying the nightlight is okay as long as we plan on eventually taking it away?
Well, as long as it's not feeding into a bigger problem, in other words, if it's just, listen, if it's your teenager who just always needs a nightlight, I think it would probably need to be addressed, right? If it's a 3, 4, 5, 6, 7-year-old, you know, it could be, again, and is there fear, like, is it just helps them? Is it just the nightlight? Do they have generalized anxiety in all places? You have to really look at cases. So generally, the nightlight is okay. But if it's a bigger problem, like you would not, most of you, if your child goes ahead and says, I'm scared of the dark, say, sure, honey, let's put a little nightlight. Say, okay, thank you, mommy, and goes to sleep, or they do it. You're not going to be asking the question, okay? If you're going to ask me, is a nightlight okay? Then clearly it's not enough, or they want the bigger nightlight, or they keep coming out of their room even with the nightlight, and they're scared of noises every 5 minutes. It's not just about the nightlight. It's not solving the problem. It's more impairing. Permitting avoidance, telling the child you can stay with them the whole time, you'll hold their hand, drive them to school because they're scared of the bus, you just drive them to school or do whatever they want. Call the teacher, give them more time on the test. You know, they're just so nervous. Oh, you're going to call the teacher, by the way, my child, no detention for my child. They get anxious with detention. Just, could you actually go over tomorrow and tell my child that there's a rule that she's never going to get detention again for the rest of school? Right, so special permissions, avoidance is just reinforcing the process, and that's really not helpful. So here is the delicate balance. It's being the skillful dancer on the dance floor. It's the validation, the reassurance with the exposing approach. Giving some of that and just finding that balance. You have to observe and evaluate. Is it working? Or am I too much on one end? Do I have to be more gentle and easy? I have to be effective, not get stuck in principle. Principle is exposure, no nightlight, right? That's getting stuck in principle. You have to look at being effective. Sometimes in therapy, I actually see I'm pushing too hard. I've had this many times. I'm pushing towards exposure. The person's getting overwhelmed. They're not responding. I need to step back. They're not ready for it. They need some other strategies. They need other techniques. It's too overwhelming. So you have to find that delicate balance. This is the final slide. So I'm going to take some questions. Just a couple of things, and then I'm going to take questions. Here's 5 steps, based on what you spoke about. By the way, every single thing I spoke about, I could give a full talk on using each of those techniques and strategies, but my goal here was to give you an overview and an awareness, and you can certainly learn more. 5 steps to follow when feeling anxious. Number 1, label my emotions. I'm feeling anxious, I'm feeling scared. Just saying, just the child saying, Mommy, I'm scared. Daddy, I'm scared. I'm anxious. Let someone know that you're feeling this way in a way. 2, remind yourself that anxiety, that is your anxiety is making me think these thoughts, and they're not necessarily a reflection of reality. Is that when I have anxiety, I have a lot of thoughts in my mind that aren't necessarily true, and I have to become a detective. I gotta check them out. I have to look at the evidence. One of them we asked, like, what would you tell your friend in that situation? Oh, I would tell her it's okay, don't worry about it, it's fine, it's not so scary, right? Objectively, they can often come up with responses. That was one of the questions. Use skills to change the way I'm thinking. Use a thought record. There's certain techniques or a thought record to write down thoughts, respond. Relax my body, feel calmer. Use some breathing. There's abdominal breathing, which is like, you can tell the child to put their hand on their tummy, and when they breathe in, make sure, like a balloon, when you breathe in, your tummy goes out, and then you let it out. It is helpful to let the breath out a little bit. The exhale be a little bit longer than the inhale, so you can do it through their nose, or just slow breathing, peace breathing can be helpful. Relaxing. You can help them tense their body, each muscle at a time. You can hold their pillow really tight, your legs really tight. Hold it for 10 seconds. Relax. They can imagine a nice scene. They can listen to music, guided imagery, calm their body, mindfulness. Those seems to be really helpful. And expose myself to my fear until I get used to it. Do it again and again and again until it goes down and down and down and down. So here are like 5 steps that you can address with the anxious child. I'm going to take, so going back to Jack's story, we're going to the nurse, right? He was getting special permission to go to the nurse. Mom was driving to school. Maybe he needed to take away that. He needed some exposure. Go outside a little bit. Let's do one step at a time. Doing some exposure, validating, normalizing stuff. Lots of skills and strategies that can be used in that situation. Here's just some, I'm going to take questions. Here's just some information about me if you want to contact. This is my group practice. Here is information where you can get my book and other free resources, and where you can follow me on social media. There's book bonus material that's free. I do have a special offer for you. On my book, I developed an online automated master parenting class where I teach about, it's the book plus, it's about 13 hours of content. You actually have lifetime access. You can go online at any point, and I teach all these different skills and strategies. Not for anxious children, by the way, for all children, general parenting, and based on my book, and for any emotional sensitivity, or kids who have ADHD, or DNDD, or oppositional defiant disorder. So the course is $897, but I do have it for those who purchase it within the next 72 hours. If you want to text that number, you will get a link, a $297 link that's available for the next 72 hours, or there's a direct link, and you can purchase. For those who purchase it tonight, purchase the course. I also give out a free book. I have books to purchase, but if you purchase the course for $297 now, I will give you a free book. Thank you so much. I hope I didn't go too quick. Anyone wants to leave, I understand. The hour's late, but I'm here and welcoming any questions, examples, or that. Go ahead.
So, a little bit older child, 12, with like your generic tummy ache and doesn't want to go to school. So one time you let them stay home because you just don't feel like fighting about it, and you know the kid is not sick, and it's purely anxiety or social related. And then the next time they say they have a stomachache and you force them to go to school and they're hysterical crying and you feel like the worst mother in the world, but you're like, what are you supposed to do? You can't miss school like once a week, like you said. So where you tell them the stomachache is anxiety, it's a physical symptom, blah, 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 and like, where do you go? Because either they're missing school or they're going to school upset, so it's like a lose-lose.
So if they're willing to get self-help, or you can go to a self-help book with them, or you can actually teach them skills and strategies that look at the fear, look at the threat, as we talked about some of the cognitive work, understand the idea of exposure, look at the worst case scenario. I mean, there are lots of other techniques that are used in anxiety. If it's an older child, perhaps, and if it's impairing them that so much, they might need more professional help. But helping them understand anxiety, is this he or she willing to talk to you, work through it? Do they want help with their fear of going to school?
Yeah, I mean, it stems from like a bullying thing, so it's really
Okay,
like...
so the threat is real.
Yeah, the threat is
So
real.
if the threat is real, then maybe you need to address the threat. It's not a distortion. Now, I'm sure you are, because you're a good mom, and you're doing everything you can to try to address the bullying situation. But then maybe, if the threat is real, and she still needs to he or she still needs to go to school, is can you increase the resources? The ability to be able to cope and deal with the bullying and the emotional, and giving them more skills in terms of bullying skills to be able to. So if the threat is real, and I'm saying just go to school, I'm putting them right back into the threat. And it's real, and then they don't want to go. I wouldn't want to go if I was being bullied like that every day. So in that case, either, help them, essentially, I think it's either address the problem there or help her be able to, even though it's not the child's responsibility, it's not their fault, but this is the reality of the situation. Yes?
Do you think like if your kids have, and they're a little bit younger, like second grade and fourth grade, have some anxiety, but it doesn't affect their everyday life? If you don't address it and you just let them be, will it get worse, or will they outgrow it?
It's hard to know. It depends what the anxiety is. I mean, like a lot of times you see families, and maybe some older siblings do have a lot, difficult. I think to be aware of it, to observe it, as I talked about, and I've given a whole talk on building resilience and strengths and modeling, but doing everything you can to have a supportive, healthy environment, build their strengths, so that if they struggle with anxiety, they'll be able to deal with it, they'll be able to cope with it. I wouldn't run to intervention and put them in therapy or give them medication because they have little bits of anxiety impairing them. And again, look at us here in this room. I'm sure some of us have mild to moderate levels of anxiety, but we work through, we deal with, there are certain things we give to our spouse to do because we just can't do it, it's just too much. So I think it's okay if they learn to compensate, they use their strengths, they use their supports. I think that's okay, but I'll just keep an eye on it. And then talk a lot about emotions. Give them an opportunity to express themselves, to talk about anxiety, to normalize anxiety, that they can judge their own emotional experiences, and that they might be, and look at the benefits of anxiety, right? I always tell moms and dads when they have their kids like that, I said, your kid is not going to be the first one who's going to take that substance when another kid is handing it over. Okay? They're going to be the ones that are a little bit more hesitant, a little more scared, they're worried about their benefits, by the way. We don't want to get rid of that so fast. So, I have some child, a couple of children, age and I have the child is like high impulsive around. I'm like, I wish he had just a little bit of that, But he has his strengths, they have their strengths, Yes.
Something working with like going to a friend's house, slowly, that you have time for because you could do this one day, this another day. Something like school where you kind